Press Secretary Philomena Robertson. Thank you so much for joining us for this week's post-cabinet press briefing. To members of the media in the room, thank you so much for being here as per usual. And to the audience on radio, television, social media, we're happy that you're able to tune in today. Ever since the outbreak of the coronavirus a few weeks ago, concern has been growing, and rightly so, because of the rapid growth of the numbers of those affected and the growing spread. The outbreak, which has its epicenter in a Chinese province, has now been categorized as a global health emergency by the World Health Organization. The Ministry of Health is working in collaboration with other bodies, including the Grenada Airports Authority, and they have been taking decisive action to prevent the disease from reaching our shores. This morning, I have with me Health Minister, the Right Honorable Nicholas Steele, Acting Chief Medical Officer, Mr. Francis Martin, Head of the Epidemiology and Surveillance Units, Dr. Sean Charles, and on my far left, General Manager, Grenada Airports Authority, Mrs. Wendy Williams. They will be the facilitators for this morning's exercise. Minister Steele, I would start with you.
Thank you, Philomena, and good morning to you all and all of our viewers and listeners out there. Yesterday, we had a meeting of all the Caribbean health ministers, conference call or WebEx call, which was held in conjunction with Caribbean Public Health Agency, or CARFA, with CDEMA, Caribbean Disaster Emergency Management Agency, as well as CARICOM Secretariat, and IMPACTS, which is CARICOM Implementation Agency for Crime and Security. We also received presentations from Pan American Health Organization and the Florida Caribbean Cruise Ship Association, all to deal specifically with the coronavirus outbreak in China and the mitigation efforts, etc., that we are taking here. Coming out of that, there were various decisions made, but before we get to that, what I would like to do as members of my team, Dr. Martin, to share with you one of those presentations that were given to us yesterday so that you would have that information too. This is a presentation that was given to us from CARFA. We received two presentations from them, but what we have done is condense it into one to share with members of the media. Thank you.
Okay, so this is the presentation that was shared with us regarding the current state of and response to the coronavirus in our region. As you're aware, the coronavirus is a virus that causes severe respiratory issues, and it was discovered in Wuhan, China, since December 21st. It's a new virus. It was not previously known to us as humans, and not a lot is known about it as a result of that. Human-to-human transfer is now confirmed, and the major human-to-human transfer is happening in Wuhan, with some happening in other parts of the world as well. This represents what we sort of call the epicenter of it. Wuhan, the Hubei province, is still the place where most of the infections are happening. As you can see from this data, more than 95% of the cases are happening inside of China still. And similarly, most of the deaths are happening in China, with now one confirmed death outside of China, and I think that's probably the Philippines or so. Our Caribbean Public Health Agency is the lead agency for guiding ministries of health in the Caribbean as it relates to this particular public health threat. And all other public health threat, CARFA is our main lead organization for us. CARFA has taken some key actions, and it includes things like setting up their incident management team. They have had virtual meetings with the chief medical officers and other officials. In fact, there is a meeting with the chief medical officers that is happening now as we speak, but I've had to leave it to come here, and I hope that they can record it so we can have a sort of a coordinated response of all the chief medical officers in the region. CARFA has also put together some situation reports and have submitted and circulated this to the Caribbean. They have had regular meetings with CDIMA and other CARICOM states, OECS and PAHO and everyone. They have released press releases in collaboration with CDIMA and other important public health agencies in the Caribbean. They have had significant bilateral meetings, and Professor Ferguson from the Imperial College of London was one of those persons. They have coordinated with CDIMA on those issues, and as I said, they've convened virtual meetings with all regional partners. In fact, one on January 28th, a very significant meeting was held with the Regional Health Communications Network. And so these meetings are continuing, and coming out of these meetings, CARFA is putting together very technical, serious technical documents that should guide the response in the region. Those technical documents will speak to travelers and how countries' response to travelers should be. Those documents also speaks to algorithms of management of cases, and what do you do if you suspect a case, what happens thereafter, guidelines for ports of entry, and of course the risk assessment in our region. We are sure that we may not be able to keep coronavirus out of our region for very, very long because of globalization, but certainly we can decrease the impact of it if our response is coordinated. And so we really do need to communicate on this and collaborate on it. CARFA went on to suggest concerns or list some concerns and comments for CARFA or Caribbean member states that should guide overall, and this is probably where your interest may be a little bit more. When it comes to travel from China to the Caribbean, we have to focus on reducing our risk and ensuring that we keep this as much as possible. We are encouraged by the fact that Hubei remains under lockdown with no travel in and out and highly restricted travel inside of Hubei province. That encourages us. CARFA is suggesting that, or is commenting that points of exit screening is actually happening in China. Everyone leaving China, the mainland China, are screened on exit. Temperatures are taken and interviews for symptoms and possible contacts are taken. And the term we use is probing interview, and that is suggested for immigrations as well. There must be probing questions. You do not just need to ask where you're coming from. There should be more questions being asked. And CARFA is also suggesting and is prepared anyone traveling from China to the Caribbean to do lab testing for the coronavirus. Travels from China to the Caribbean again, points of entry screening is happening in those countries over here. And of course, they're commenting also that countries that deny entry of foreign nationals traveling from China, those are the countries on the right side of here that are now denying entry of foreign nationals traveling from China. As you can see, most countries are taking the position of allowing nationals a little bit more latitude than non-nationals, and of course exit screening for all of the big major cities. CARFA is suggesting that we avoid all travel to and from China. Especially non-essential travelers. All Caribbean citizens should postpone travel to China until the all clear is given. And those are some of the suggestions why people may be traveling, and CARFA is suggesting that we do not do so. And for those who make it through, all will be quarantined upon return. And the latest information we have is that quarantine is needed only for 14 days or 2 weeks. This slide speaks to what has to happen at our port of entry, and the slide is a little bit fuzzy, but this slide actually speaks to what we should do if someone finally makes it through to our Caribbean islands or to Grenada from China. We recommended that it doesn't happen, but what do you do if someone actually makes it through to Grenada? On the left, it speaks to what you should do, the humane thing to do, and it is very clear that you do not send people back to their places they originated from, because in so doing, it is extremely risky to do so because you expose, it's called double exposure. Persons are exposed when they come to your show, and if you send them back, you're exposing other persons to them, and CARFRA is suggesting that we do not do this at all. They're further suggesting that we must have isolation units or isolation capabilities at the ports of entry, so to speak. On the right side there is the algorithm that is suggested. And I was just speaking to Dr. Sean Charles a moment ago, and I said, you know, we did our algorithms, was it Sunday night? So we were ahead of CARFRA in doing our algorithms, and fortunately for us, the algorithms that we put together for in-house management is very, very similar, if not the same, to what CARFRA put together. It's also important to note that we do have an isolation unit stationed at the Maurice Bishop International Airport, and that's the isolation unit we've used for the cases that we have seen. And we can go back to the... For returning citizens, CARFRA is suggesting that all citizens should be allowed to repatriate. And those are the countries that have taken those positions. Grenada also have taken that position, that non-nationals will be allowed in. If they are without any symptoms, CARFRA is suggesting someone returning with no symptoms at all should self-quarantine at home. That's what they're suggesting, but I don't know if we want to do that here on the island. So we've taken the decision that we will not allow self-quarantine at home, and we are going to quarantine ourselves. And the provider should be given, should be the healthcare provider in the area will do daily surveillance to check the temperatures and check the symptoms, and that is what we have been doing. And as we said, the public health officials should be allowed for quarantine up to 14 days. For non-nationals, again, they're suggesting that quarantine should take at home. But again, we are a small nation, and we believe that we need to have a better hang on this, and so we're going to take that responsibility. And again, the symptoms should be taken every day, temperature taken every day, a brief history taken every day, and quarantine for 14 days. Those are the actions that CARFRA is suggesting for citizens, students, and permanent long residents. Again, these are the things, no symptoms, if there are symptoms, and this is just a reiteration of the algorithm that we have already put together. Do a risk assessment, and depending on what happens, you either isolate or you test. Then you test those persons, and then of course we case management as the need arises. And again, this is a similar slide to the first one, and this slide actually speaks to non-nationals who are traveling. You don't need to fix the slide because it's the same as the first. It's just that one speaks to citizens and the other speaks to non-citizens. It speaks to do your case history, isolate, and test if necessary. At screening at ports of entry, CARFRA is saying that we must now do screening at ports of entry. And we have actually started doing so. And that gives an added level of assurance. And as I indicated earlier, they're suggesting that immigration should ask more probing questions now. It's not a simple matter of indicating on the form where you've been in the last weeks, and some persons may even not bother filling that part on the immigration form. And our immigration is advised to do so. Personal protective equipment, CARFRA is suggesting that at ports of entry, we should have port health officials and other medical staff use quarantine PPEs, as we call it, personal protecting equipment, and we also are prepared to do so. They're suggesting that we have adequate isolation capacities at the ports of entry, and I've indicated that we do have one set up at the airport. Lab testing. Prior to, as the case developed, since the World Health Organization has declared this as a public health emergency, a global public health emergency. We are happy to say that the region now has the ability to test, to do lab testing. Unfortunately for Grenada, we also have two opportunities to do the testing. We can actually send to CDC through CARFA. We can actually send to CDC by ourselves. And also SGU is now able to test for the virus. So that's great. That's really great for us. In fact, we have the epidemiologist has just suggested to me, told me a while ago that we have sent off samples to the Center for Disease Control, testing for the coronavirus as well as testing for influenza, which is another virus that is causing significant problems globally. In fact, influenza is causing more problems globally than it is for coronavirus at this point. CARFA is also suggesting or saying to Caribbean countries that all private flights from China should be accepted, but they must follow the commercial flight routes, not the usual courtesy extended to private flights. So it will be treated as a commercial flight. Cruise ship. No passengers from China should be allowed to disembark on because, of course, they pose a greater risk. And all cruise ship must have pre-boarding screening, but no passengers from China over the last 14 days. At our CMO's meeting a while ago, that they began speaking about this particular issue because there was a cruise ship that was getting ready to sail off one of the ports in the Caribbean, and they were very clear that those ships should not have any Chinese nationals. That has been no passengers from China in the last 14 days. If passengers get sick on board, the CDC recommends that a 3% accused gastroenteritis, that the ship return to the port of origin. And this is something that needs a little bit further discussion. What happens here as a precaution, what happens when a ship sails to your port? Our port health officer goes onto the ship to assess the health of the passengers. It is called a health declaration form that you must get either from the airplane or from the ship. And there is a calculation that is done that assess how many persons on the boat are sick related to the entire number of passengers on the boat. And if the numbers of persons that are unwell are above 2%, then the decision has to be taken that boat should not disembark anyone. And of course, if it is less than 2%, then the ship can disembark healthy passengers, but not unhealthy ones. Those are sick that should not disembark. And that is a practice that we have done here. And yesterday, just to ensure that I was satisfied that the process was indeed accurate and it was happening, I accompanied the port health officer to two ships to see the process, make sure that I was satisfied that enough due diligence is being paid in terms of the health of the passengers and the decision to grant pratique or to grant the freedom to disembark. I also took the opportunity to speak directly with the physicians on the boat, so that myself, to let them know the seriousness of this and what it can mean for us, and that they really do need to follow those procedures. And I was sufficiently satisfied that the process was being followed well, and of course the passengers disembarked. Wearing of masks. It is important to note that the surgical masks that you see, the ordinary mask, does not offer protection. It must be an N95 respirator that offers true protection. And CARFA reiterates that the health staff, the port health staff, and the quarantine staff must wear those masks. There is no recommendation for this mask to be worn by the general public at this point in time. And they are constantly updating the numbers and the process. And in fact, we're at the CARFA CMO meetings, we are not waiting for the virus to show up in the region before we start discussing procurement of the mask. We're actually discussing it as we speak. In fact, Grenada has actually ordered more than 10,000 of these masks already. And I think this should be it. That's the end of the presentation, and we will be able to answer some questions if you need to.
Thank you very much. At this point, we'll take a slight break just to accommodate our television production, and we'll be right back momentarily. Welcome back to this week's post-cabinet press briefing. We are continuing to speak about the coronavirus, and we have with us this morning officials from the Ministry of Health, including the Health Minister, as well as Ms. Wendy Williams from the Airport Authority. Where we left off just now, we were speaking about practices at our ports of entry, and it's a perfect point to segue to Ms. Williams to speak about what's being done at our ports of entry locally. Ms. Williams?
Morning, everyone. Now I know that this is of national interest, this particular issue of the coronavirus. I must state that at all airports worldwide, we are guided by international health regulations, which guides airports into how to handle pandemics at airports. Our airport is no different. So when the World Health Organization escalated the coronavirus as an international health concern, the airport immediately, in collaboration with the Ministry of Health, started vigilantly to upscale the normal surveillance that we supposed to carry out as an airport. In that regard, we can attest that the airport has increased training for our staff via our safety manager, who will be having ongoing training with those who are more at risk in our airport environment. Our ASG staff that clean the plane, our customer service staff that greet passengers in the immigration arrival hall, the immigration officers, customs. We have intention of increasing our training awareness programs in that regard in the coming weeks. For the airport, temporarily right now we have an isolation unit at hand that is in place, as well as we have in stock all our PPEs in relation to equipping ourselves or protecting our workers from this virus if it ever comes to our shores. I must state that the Airports Authority, in its quest to improve in terms of our resources, have now approved the purchase of an upgraded isolation unit, a 4-bed unit that it's like a mini hospital but mobile, and that will come in the coming weeks ahead. We are all doing this in collaboration with the Ministry of Health. You may ask, what happens when a passenger arrives, and what do the airport and the Ministry of Health is doing in relation to the reception of such persons? One, we have secondary screening if a suspect case is on board. And if that suspect person is in secondary screening, we also have the isolation unit as a backup. And that person is carried to an undisclosed location for further quarantine. I guess you would have heard a lot this morning in terms of the incubation period and the isolation of that person and who they are, whether non-national or nationals coming from China, and the quarantine process for that to take in terms of that. But the airport has already sent out a NOTAM to all incoming aircraft and pilots with immediate effect that if anyone on board display flu-like symptoms, we must know before that aircraft lands on our shores. So that if it does, when it does land, that we could mobilize long before it lands. We have taken that step, that first step already. Once that aircraft lands, the public health inspector from the Ministry of Health boards that aircraft, and he will determine or identify or say whether from the health declaration form that is handed to him, whether there are any suspect case on board or if anyone goes to secondary screening. If an aircraft has to be isolated, we have protocols in place for that. Every airport, we have to have isolation area for aircraft that is isolated with these type of issues. I must state that the Airports Authority, like the Ministry of Health, has also ordered N95 masks. We also ordered a lot. And we also have to order goggles beside the face masks, hazmat suits as well. So we are well prepared. I'm saying we are well prepared for any eventuality in that regard. I will now take questions.
Before we go into the question segment of the press briefing, I'd like to invite Dr. Charles. Do you have any comments to add to the opening session?
Right. So once a passenger of interest is identified, we have developed protocols that determines where that passenger is, how that passenger is disembarked, what route the passenger takes, where the passenger is screened, and depending on the results of the screening, right, we do both temperature checks, we do a survey for symptoms, and we do a detailed travel history. If the history is compatible with travel to China within the past 14 days, if the person has no symptoms, then that individual is quarantined, all right? And we have the facilities already set up to arrange for quarantine. And as was said by Dr. Martin, we are not doing self-quarantine. We are doing mandatory quarantine that is under the supervision, under the control of the Ministry of Health, all right? If the person has symptoms, then that person will be isolated and treated. Now, persons who are under quarantine, we have set up the protocols for monitoring them throughout that entire process. All right? They will be monitored, as was mentioned, for 14 days. They will have temperature checks, they will have symptom checks, and they will be monitored. All right? Once that 14-day period elapses and there are no symptoms, they have not developed any signs of disease, then that person is cleared. All right? If at any point the person develops symptoms, the person would become a case. All right? And then we will follow the protocols that are involved in treating a case. So we've set up all these processes so that we are able to capture someone from entry and monitor them all the way up to whatever the final outcome is.
Thank you very much, Dr. Charles. The floor is now open. Members of the media, as per usual protocol, please identify yourself and your media house before asking your question.
Good morning, Callistra Farrier. 10,000 masks on their way. Can I have an idea of, apart from first responders, healthcare officials, people who are dealing with patients, who else is going to be having access to this? Is it strictly just for our health practitioners and so who are on the front line coping with this? First question. My next question, how many people do we have in quarantine to date? And my third question, should anyone develop symptoms as a case of coronavirus here, where will they be treated? And if at the general hospital, could you please tell me the setup for treating persons at the hospital?
At the moment, we have about somewhere between 6 and 9, or about 8,000 masks, and 10,000 masks are on the way. Guided by the public health response from CARFA, the recommendation is that the masks will be worn by frontline staff, quarantine staff, and staff who are actually treating symptomatic patients. And that's really the general recommendation at this point in time. Your second question had to do with... Oh, we have 2 persons in quarantine at this point in time, and in the event that someone develops symptoms, we have identified and prepared isolation areas within our hospital system for the treatment. In terms of asking how is it set up, I don't know if I can say how is it set up. It's a clinic, it's a ward, and the general setup of a ward is what that setup is going to be like. The important issue is that it is separate from the rest of the hospital. It is an isolation area, and it is prepared to treat patients if necessary.
So, Rena Pear from GBN. I don't know if it's Dr. Martin or Ms. Williams that would answer this question. I know that I've heard that a lot of work has been done as it relates to isolating individuals who may have had symptoms as it relates to the coronavirus. Now, these persons on the plane would have interacted with passengers. What about these passengers? Are they going to be quarantined as well? The symptoms will show in 14 days or within 14 days. What has been done?
This is managed at the intake level. When a plane comes, the port health officer goes to the plane and make an early determination there. If that patient has been having or had symptoms on the plane, the recommendation is that anyone within 6 feet of that person will also be quarantined. Fortunately for us, we may have an idea of that because we now get an advanced passenger listing with the seat number. So we know where everybody is sitting on the plane. If that patient on the plane has had no symptoms at all, that means they are actually not spreading the virus because they have no symptoms. But if the port health officers suspect that this is a person of interest, meaning their travel history suggests that they are exposed, then that person goes through the process that we just discussed. But the recommendation so far is asymptomatic persons, anyone within 6 feet of them, there is no need for quarantine at this point.
As it relates to that, you had 2 persons quarantined. The passengers in those particular flights, what is happening to them?
Those 2 in quarantine had absolutely no symptoms whatsoever. They were quarantined solely on their travel history, and so they pose no risk to anyone within 6 feet of where they were sitting. And since then, those persons have been checked every single day. In fact, I have one of them on my WhatsApp. and the temperatures are reported to me on a daily basis.
Christina John, GBN. I'd like to get a better understanding of the setup at the airport for when these persons come in supposedly with symptoms and so, because why I'm asking is that what if someone displays symptoms of the virus and they're in contact with someone else who displays a similar symptom but is not related to the virus? Can they not get infected? I don't know how the setup is like. Could you explain?
Okay. We have two categories in terms of travelers of interest. A category called no symptoms present in that person, and those who are displaying symptoms of the disease. If there are no symptoms present, and it's just based, as Dr. Martin said, on their travel history, we will send them still to secondary screening. There is a nurse station in the arrival hall, and in that nurse station is also a tent that is set up for secondary screening of those passengers. They will not join the normal line in immigration, and they will not come through the normal door to immigration. They will go through another door into the nurses' station where the secondary screening point is set up. From there, they go to the isolation unit that we have on compound. It's a mobile unit, and from there, they are mobilized by the Ministry of Health to the hospital. But there are two categories, as I said, those who are displaying symptoms, and those is just based on travel history. And yes, they will be presented with a mask. They will be presented with the PPEs that are necessary for quarantine. In terms of screening, what the airport has done in collaboration with the Ministry of Health as well is this: we have in the immigration arrival hall also thermal screening sensors, digital thermal screening sensors that actually picks up the temperature of everyone coming through. So if we miss anyone, from the time you come through that door in immigration, you will have to pass through that sensor. Okay? We have also have in our possession as of 2 days ago, and we are going to erect a second sensor, digital sensor, so that we can pick up those that even if we miss you at the first entry, we could pick you up on entering the immigration arrival, the customs baggage hall. So these are some of the things that we actually immediately have put in place in order for us to do the screening process of passengers displaying flu-like symptoms of the disease, or if they have a travel history from China.
Just a little bit more clarification. If someone has, based on their travel history, do these people, say, intermingle, even though they're going to a different channel than the regular other passengers? Do they mix at some point?
No, they are not going to be mixed because the mobile unit is set up airside. It's airside. Where the nurses' station is, there is a door from the ramp straight to the nurses' station. Okay, so there will be no mixing with the general population of the airport or anyone in the airport except the nurses, and they will be well equipped with their PPEs to handle such cases. Okay.
Just for members of the media, we do have images of the digital thermal screening sensors in operation, and we also have a number of photos that we can share with you of various steps in the processes that are being implemented by the Ministry of Health in collaboration with the Airports Authority.
So I just wanted to add to that answer. Once a passenger of interest is identified, they do not enter the regular route to clear the regular landing procedure. All right, they are routed to that alternative route where they are screened by the medical personnel. They clear their immigration procedures there, and if they need to be quarantined or isolated, they do not re-enter the general population. They are moved directly from there onto their final destination.
Go back to that image. This is the port health boarding the plane. So persons of interest would be known prior to the plane landing in the first place. In some cases, we know the person of interest prior to the plane landing. And in this instance, person of interest will be identified when the port health gets his health declaration from the pilot to ensure that everybody on the plane is okay. And from there, the distinction starts. So there is really zero chance of them mixing with anyone on the ground or staff or crew. And this is our, that's us meeting the students that travel from China to Grenada. The recommendation is that they stay in a well-ventilated area, not closed up. So this is at the nursing station, a well-ventilated area. We don ourselves in preparation for isolating that student. And this one with the thermal camera, it would be great for her to actually see that thing in motion. In front of the thermal camera.
Show them the image of the camera.
There was one you showed where we were able to see, yeah, this one. You can actually see passengers coming through, and the temperature is actually written on the screen over their heads. It's very faint, but at the screen you can actually see it much better. In this case, that person's temperature was 37 degrees, which is normal human temperature. It's quite fancy technology. Oh, here it is. 34 degrees Celsius. Yep. 36 degrees Celsius.
See, and she actually stopped looking to verify that the camera.
Oh, shit.
Do we have further questions? Anyone who has not had the opportunity to ask before?
Chrisanne Mitchell, GIS. Concerning sea travelers, what's the procedure for them? How will they be screened? And also, how many stations of quarantine points are there?
The easier one first is the last one. The number of quarantine stations would be dependent on the number of persons that needs to be quarantined. At this moment, there are only 2 that needs to be quarantined, so only 2 locations we have. Regarding sea travelers, we are very fortunate in the sense that sea travelers have a very much more rigorous screening system for persons that they take on board those ships. Quite advanced, when passengers go on to the ship. Similarly, they have an extremely rigorous process for persons coming off the ship. They have very good isolation units, much better than a lot of countries. So we really don't have a huge problem for travelers by ship, but except to say that the process is still the same. They are screened for temperature as well as symptoms. And once they are deemed a fever or have any upper respiratory tract symptoms, they are denied the ability to disembark or embark in the case of where a ship is actually taken on board. And the world cruise ship industry, they are very, very much aware of this. The World Health Organization has been very clear with them. In fact, one of my friends who works in the cruise ship industry actually sent me the latest report or the latest guidelines that these ships are actually practicing. It's extremely rigorous. So that is quite fortunate for us in the region in that risk is actually quite low.
Okay. And what about the yachts coming in to Grenada?
The yachts coming into Grenada has always been a challenge. It is something that we continuing to work with our customs agency for that. Fortunately, at most of the places where yacht, hang out, there's usually a customs agents there, and we're quite happy that they're willing to work with us to help us with the health declaration form. They're in collaboration with our port health officers, and so this is how we're handling it at this point in time. In fact, on Sunday, I was home and I got a call from Carriacou because a yacht had just came in there, and there were Chinese on board. I was quite happy to check with the epidemiologists to make sure that we were following the protocols, and we were following the protocols. They were cleared because they were at no risk for us, and that was actually a yacht that sailed into there. So we actually have our surveillance on that as well.
Good morning, Rachel Bain, MTV. My question is, in the event that the virus reaches our shores, are we really prepared to deal with it in terms of medication and so on?
We have no doubt that in the region, we will have the virus will reach in the region. But you have to remember one thing: this is a new virus. And we're very clear, it's a new virus, so there are no vaccine and there are no treatment for it. Yeah. But the good thing about this particular virus is, so far, the mortality rate or the death rate associated with the virus is actually extremely low. It's about 2%, which is really greatly low. However, I am going to use this opportunity to guide on something that I've always said from the beginning, and I didn't just want to sideline coronavirus. Yes, coronavirus is there. But what we need to understand, there is something far more deadly and fatal than coronavirus that sometimes we don't think about, and that's influenza. Preliminary reports that we got just a few days ago indicates that there are about 19 million people with illnesses associated with influenza. In the US alone, 8.6 million medical visits. They have hospitalized 180,000 people. And deaths from influenza in the US alone has been 10,000 from October to now. 10,000 just from influenza. So while coronavirus is capturing the headlines, the world of public health officials, we are worried because social media has caused such a problem with coronavirus, and that takes away the light from influenza. And meanwhile, influenza is killing millions of people. BBC did something the other day, and Kevin and I was just discussing this new word that we learned. Infodemic. Not pandemic, infodemic. Because for the first time, social media and false information, people have chosen to use false information in a lot more sophisticated light than true information. This is a horrible place for us to be at this point in time. There is true information out there, accurate information out there, but somehow people have chosen the false information that is intended to hurt others, information that is intended to malign other people. And what's worse, the media has sided on the part of those false information. That is a terrible place to be. When people have decided to damage an entire country, damage an entire people, put so much people at risk just because we choose to accept and disseminate false information. Infodemics. I will remember that word.
Can I ask a question now, or am I still in quarantine? If we do have, you keep saying it's going to come, it's going to reach our shores, and as we see from other places, it's spreading. While the death toll is not that high, the spread of it seems pretty fast to me. what are our capabilities for mass isolation? You talk about 2 quarantine areas so far, which means that we're putting people, each suspected case, so each case goes in a separate place. What happens if, God forbid, we do have this virus here and there are a lot of people with it? What are our capabilities? I do remember the Minister of Health saying that we don't have a National Guard and we don't have the capabilities to, head to the National Stadium and set up a mass quarantine area, and we would have to depend on the kindness of strangers in this one. So can you bring me up to speed on what is the situation there in that regard for Grenada?
Well, I don't know where the minister get his information, but what I can tell you is that we have preempted this, and at the Ministry of Health on our hospital system, we do have a contingency plan for mass isolation if the need becomes. I hope it never becomes, but yes, we do have a plan in mind.
In an attempt to reassure the nation, can you give us any information at all on what our plan is, or is that one of those things that is a secret too?
As so often in health, we have to be sure, we have to be careful. We cannot preempt anything. It has to be dependent on the circumstances that present itself. So I am not able to say what I don't know, because we're not there yet. Just like with the coronavirus, we're still learning as we go. We, as the epidemiology changes, as the pathology becomes more clear to us, as the science the science start to tell us more, we'll be able to tell the nation. It is important to note that we do have an area of isolation if it needs be, but because we don't know how much it's going to need and what's going to happen, I can't say more than that.
Maybe I should interject slightly here and say this. If the virus ever does make it to our region, or to our shores for that matter, what we would be advising folks is, 1, hand hygiene, cough etiquette. Don't cough or sneeze into the air. Wash your hands. Avoid persons who are sick. Seek medical attention if necessary. Teach your children, healthy practices so that they avoid diseases. Because as Dr. Martin said, for these viruses, there is no treatment. There is no vaccine that has been developed yet. Prevention is the best option. The Ministry of Health will do all that it needs to ensure the health of everyone. But we would need the assistance of the public and of the media in spreading the word that it's simple. It goes back to simple preventive measures, public health measures, that will need to be instituted to reduce the impact of this disease.
There's a situation at the bus terminus with the students who congregate there by the scores, by the hundreds, for hours on end in the evenings underneath that area there. Is that an area that has caught your attention and is causing any concern should the virus be here in terms of spreading? Because we know that commute and crowded areas and so is something that's being warned against, and we have just that seems to be a little nucleus of a situation that could help with the further spread of it. Does that particular incident that happens almost every day at the bus terminus cause concern for you?
Let me interject and say that the warnings for avoiding crowded areas and so is in China, where there is an outbreak. There is no outbreak in Grenada, so our students are quite welcome to congregate and pass through our bus terminus, etc. There is no outbreak in Grenada.
Okay, Minister Still, Jesus. Minister Still, final question. I have so much I need to ask though. But it's relating to the students. Now, last press briefing, you were here, and we spoke about the students coming in, and you said that China reassured, well, not students, but the plane coming in, you said China reassured that their procedures over there is very strict. How did the students manage to be here? And were we aware that they were coming? And what if more is coming? How are we going to be dealing with this?
Yeah, we are aware. Now, you got to filter through all information that you're being fed also from other international news sources. As of today, there are still flights landing in JFK and London Heathrow direct from China. As of today, there are 5 flights from Beijing landing in London Heathrow, and there are 2 flights landing in JFK, direct China Airlines. The other commercial airlines have decided not to fly for different reasons. For instance, we were informed Air France decided not to fly because their flight attendant and pilots union made demands and gave the airline management pressure to stop flying. Other airlines, British Airways has stopped flying direct to China, but you can still book a ticket on British Airways today to leave London tomorrow and get to Beijing. British Airways will route you through Hong Kong and then put you on their code-share airline, Dragonair, from Hong Kong to Beijing. So the screening process is there at the Chinese ports. And the Chinese have shut down the epicenter area of Wuhan and Hebei province. But the screening process remains, and in fact, for instance, last week, when we allowed a flight in, there were 8 patients or 8 cases in Beijing. Beijing has a population of 21 million. There were 8 people in 21 million that were infected. At that same point, in Toronto, there was 1 person infected in a population of 8 million. So at that point, Toronto posed the same risk as Beijing. Remember, the distance between Hebei province, or Wuhan in particular, and Beijing is similar to, greater than actually, Miami to New York. So you're talking large land masses. I know sometimes we localize it, and for us in Grenada, the difference between 2 of our towns, and we look at it that way. But you're talking, we are seeing population centers, and we're talking over 2,000 miles in certain instances, 2,000 kilometers or so difference, and the locations, and there have been areas sealed out. Now, as it has spread, and we are saying that we recognize that there is an increase in the spread in China, although the Chinese have made significant efforts to reduce the spread internationally, and they have to be commended for that. They have closed their cities and informed the rest of the world to allow us to do so. We have saying out of an abundance of caution, you will hear most health ministers from all of the Caribbean and elsewhere saying, even the agencies, public health agencies, out of an abundance of caution in an effort to make sure, not that this is absolutely necessary, out of an abundance of caution, because as the doctors have told you, there are certain things that we still don't know. So out of an abundance of caution, we have put a travel ban here. Out of an abundance of caution, other Caribbean islands have done that. Out of an abundance of caution, yesterday St. Lucia did not allow a ship in, which under the normal regulations would have been allowed. So those are the types of steps and measures that we are taking. But remember, our students are able to get back, and we have this quarantine for Grenadians who may come back, because it is still possible to travel from China to major ports and cities in the US and in the UK and in Europe.
I know that we have
Okay, at this point, because we do have a second part to this morning's post-cabinet press brief, I'll just allow members of the head table to have some final or closing comments. Ms. Williams, we'll start with you.
One, I will say that Grenada do have a pandemic plan, which is part of our disaster emergency plan as well. And to give you some comfort, we have been breaking down these plans as simple as we could for everyone in the aviation environment to understand the protocols. That I could tell you. Also, in the next coming weeks, we will be putting out the airport in collaboration with the Ministry of Health some videos in terms of what the passengers should expect in terms of health screening at our airports or ports of entry. And we have taken that step. And basically what I will say is that I think we need our ports of entry is well prepared at this time to handle such eventualities?
I would just like to say that the Ministry of Health, we are putting in a lot of work, trying to ensure that we are prepared and that we can respond to any event. All right, the work continues. All right, we understand the anxiety, but we are doing everything in our power to ensure that we that the nation's health is safeguarded.
My last comment is that it is very easy to stop coronavirus. It is extremely easy. It is one of the easiest things I've ever known to happen in medicine, and that is to stop the coronavirus. You can stop it by washing your hands, avoiding personal space, clean yourself, teach your children to stay clean, cough etiquette, and that will stop coronavirus.
In closing, I just want to say that I also went with the team personally yesterday to meet one of our students for a number of reasons. First and foremost, we have some frontline healthcare workers and airport staff, immigration and airport, to reassure them that if I'm prepared to go there, that we have the proper measures in place. And I went there myself with our immigration officers, with our health, port health officers, and met the student also. And that's the second reason. Our Grenadian students who are coming back would have come back coming from a situation of significant stress. They do have to go through this quarantine. The two that came expected to be quarantined and have willingly gone into quarantine and are continuing to be quarantined. But I believed as a government minister, because they would not have been able to have been met by their families, that I should have gone there to make sure that while we were following those proper procedures, we also made sure to make them feel welcome as they came back home to their country. So I was there personally to make sure of that for those two reasons, and I can assure you that that was maintained in both cases, the proper procedures and our normal homely welcome. In closing, I just want to say that life does go on and there are other aspects. So as such, I want to wish Looney Spark and Electrify, as well as Skinny Banton, the best of luck. And I'm looking forward to Mr. Killer defending his crown.
Thank you very much, Minister. On that note, we come to the end of the first segment of this morning's post-cabinet press briefing. We'll take a quick break and we'll be right back with the Minister for Education and Information, Honorable Emmeline Peer. Please stay with us.
distribution network from the tank.
Welcome back
supply
to
water
this
to
morning's post-cabinet press briefing. Thank you so much for staying with us. I have with me now the Minister for Education, Religious Affairs, Information, Honorable Emmeline Pear. And at this point, she has a very quick update for us on negotiations with the Grenada Union of Teachers. Minister Pear.
Thank you very much, Press Secretary, and let me say a very warm good morning to everybody, members of the media, those who are still tuned in and those who are listening to us. I know this morning at center stage was the coronavirus, and I also noticed that I did one cough and everyone turned around at the same time. So I know our attention is focused on that this morning. But I just felt that it was absolutely necessary to just provide a very quick update to members of the media and the general public as to where we are 1 week later, thereabout, as it relates to negotiations and discussions with the Grenada Union of Teachers. Most persons would recall that at the last sitting of this post-cabinet session, I did say that we are near completion as it relates to a discussion and final agreement. But I want to just go back a bit, just for those who may have missed some of what I said at that session. Somewhere around the second quarter of 2019, most of you would recall that the GUT held its general conference, and I was invited to address the conference. At that session, I did call on the executive. While they had then announced the work to rule in effect, I did call on the executive, the new executive elected, that that call should not affect the ministry and the union sitting together monthly to discuss matters related to education. Shortly after, I received communication from the union that they are quite prepared to resume discussions with the Ministry of Education on a monthly basis. And so those discussions continued until last session, which was the month of January. And again, as I've said before, I have absolutely no reason to say that those discussions were not cordial and that they were not very fruitful in terms of the relationship between the Ministry of Education and the Grenada Union of Teachers. I say this because we have been able to discuss a number of matters. We have been able to agree on a number of matters in the interest of the development of the education system. One of the items that has featured prominently on the agenda since then is the item of repayment to teachers, as stated by the union. Of course, the government has consistently expressed its position on this matter, that this is not a repayment, that the government has absolutely no obligation to make such a payment to teachers, and that happens to be the focus of discussions over the last couple months. The government of Grenada has always maintained that this is not simply about a repayment to teachers as expressed by the union and persons in the general public. The government has made very clear that we are concerned about precedents, that what has happened, it is not something that is healthy for the education system. It is not something that the government considers to be legal action. And so we are extremely concerned that should we proceed to just make a payment, it would have been sending an incorrect message, which is what happened should happen again. Therefore, over the past couple months, we have been engaging the union in discussions as it relates to the conditions under which government is prepared to consider that payment. And as I said before, we have had months of discussions. We have not spoken publicly about those details over the past months, but we've had months of discussions. And as you may have heard last week, I believe that we are literally very close to a final conclusion and agreement on this matter. I wish, therefore, to share with the general public a few of the conditions that government is very sure that must be included in any agreement that we sign with the union. And again, I go back to a previous statement of our concern about precedence. The first thing that we discussed during that period was the issue of clarification on work to rule. And I did say that before. What does work to rule mean? We are quite satisfied that the union has made an attempt to clarify work to rule on its end. I did also mention that there is some little window where we have not totally agreed as it relates to the hours. But the fact that the union has clearly stated that a teacher who is on work to rule, which is a form of industrial action, is expected to follow the laws of Grenada, as in the Education Act, and that teacher is also to be guided by the appointment letter. In that regard, we are pretty much comfortable with the union's position, generally speaking, as it relates to this. We've also discussed that work to rule must be an extreme form of industrial action. And this is not something that every Monday morning you can get up and hear that we are on work to rule. And that is internationally known to be a last resort, more or less, when all others have failed in terms of the mechanism, industrial mechanism that is in place. The second matter, as it relates to our discussion over the past months, as in condition, is that the government has no obligation to make any payment. And that has been there from the start of our discussion, that this government is not obligated to make any payment because we did not follow the protocols and the industrial mechanisms as stated in the laws of Grenada. The fourth item, therefore, is the Code of Ethics for Teachers, which I've discussed before, which I did say publicly is a matter I'm impressed that the union is quite willing to discuss and agree upon. We have discussed the first draft of that document, and we are now in the process of working together on that final draft, which would be agreed upon between the union and the government, and then for joint implementation of the Code of Ethics. Another condition was that of legal hurdles in the way of our discussion, and we've agreed that we ought to ensure that there's no legal hurdle that prevents us, and thus far, the Attorney General has been guiding this process. The final area of commitment that we've been discussing is that of the commitment to good governance in schools, good employment standards and practices that are in keeping with the laws of Grenada. Therefore, the government of Grenada is quite prepared that once we both agree in writing to those conditions, which I hope we can do within the next 24 hours maximum, that once we agree to those conditions, the union and the government will issue a joint statement, and in addition to that, the signing of the agreement will take place. In other words, I'm saying to us this morning, I'm reminding us this morning, the commitment of our government is that we are prepared to make a payment to all teachers. We are quite prepared. The payment as it relates to monies not paid to persons during rest and reflection must be on conditions that we have been discussing for the past couple months.
Thank you very much, Minister Peer. That was an update from the Minister of Education and Information, Honorable Emmeline Peer, as it relates to ongoing negotiations with the Grenada Union of Teachers. That brings us to the end of this week's post-cabinet press briefing. We can entertain probably 5 minutes of questions.
You mean the figure as it relates to what I just, right. And I would not want at this stage to make a pronouncement on the figure. Those would be disclosed at an appropriate time, which I believe is after we've signed off and agreed upon.
And you're very confident it's going to happen in a week? The agreement?
What I can say in confidence is that the government is prepared at this stage to sign off, because we have clearly discussed, gone over all of the conditions. We've been in discussions with the union, and now we are just awaiting that final opportunity where the union and government would come together to sign off on those conditions.
The conditions, you have some conditions for the unions to agree to. Is there also a situation where everyone is going, once they agree to your conditions, everyone will be reimbursed, or some and not others? Are there any conditions for who is reimbursed among the group? And also, do you recall how much money government actually docked from the teachers?
Right, and I would not want to go into figures at this point. As I said, a joint statement would be made. There would be additional information, but I just want to update us as to where we are at this point, right? Now, the question as it relates to who will be paid and will they be paid the full amount that they did not receive for the industrial action taken, the government's position is this. If we are very clear on what happened, why it happened, and the systems and structures we have in place to ensure it does not happen again in the way that it happened, we are quite prepared to pay that full amount to teachers. But understanding, and this part of what I'm about to say is an additional decision that government has taken. The government decision as it relates to teachers who did not lose any money during that period is that the agreement of the union and the government would also include those persons, because we are speaking about a futuristic event that has to do with the agreement of code of ethics, working together, and all that we've been able to accomplish between then and now. So those persons who did not lose anything during that period, we have agreed as a government to also make a flat payment across the board to those teachers in the interest and the spirit of what we intend to agree upon. All those teachers who were not affected as a result of the industrial action.
Whose pay was not done as well.
In the spirit of the agreement.
They are also going to have to agree to the agreement, or they're also getting monies back?
When you say if they have to agree, the agreement is by the union on behalf of all teachers.
Yes, I get that, and you're setting rules and setting rules and regulations for how and why teachers can now take certain industrial action, and reinforcing that they need to follow the rules. But there's also a reimbursement of money in the mix.
Right.
But not everyone had their pay docked. So am I to understand that even those who, everybody's getting money?
And that's the point. We are not just talking about what you referred to as docked pay. We are talking about the union took a decision, which is to call off its workers from the job. And those workers that the union represents decided that they are not going to work for 9 days, while some lesser. Now, there are teachers who went to work. The union made a request for a refund of payments, and we are saying in their request, it was a request for refund. We are saying this is not just about, quote unquote, a refund. This is about the entire system, what we've been able to accomplish in the past couple months, what we plan to do in terms of good governance of our system. And so we intend to recognize all teachers in this process.
So I'm really not getting this. So let's use a hypothetical figure. December 2018 or whenever it is, government docked $5, a total of $5 from workers who did not show up for work, rest and reflection for those days. Okay, that would be, say, 10 teachers. That covers 10 teachers, but we have 20 teachers. Are we giving refunds to 20 teachers, or are we just dealing with the 10 who were out on rest and reflection?
Right, so your word is refund, right? The government is saying the monies that we did not pay you for those days that you did not work, because we've stated in the agreement, government does not have an obligation to pay any employee when they do not report to work. So we are saying in the spirit of what we have been able to accomplish, what we agree on that we are going forward with in building the education system, every teacher would be involved in that process. Every teacher has been involved. So we are taking this decision that whatever you've lost in your terms, we are going to pay you that amount. Whatever you were not paid in that period, we will pay you that in the understanding of the spirit of the agreement. But we are also considerate that what we are agreeing to is not just for this group of teachers, it's for all teachers. So when we speak about good governance, for example, when we speak about higher standards, when we speak about the code of ethics, we're speaking across the board. So that decision is across the board, and it includes all teachers.
The financial aspect of it?
The financial aspect as well.
You're paying the teachers to agree to this?
Mm-hmm. No, you probably did not hear me, Callistra. You did not hear me. Now I'm saying to you that the union took a decision. They've asked us to take an action, and we say, no, we cannot take that action because you breached protocol. You did not follow the law. However, let us sit down and discuss where we are, where we've come from, and where we're going as an education system. And in that process, you recognize that there are teachers who reported during those 9 days who were part of all that we agreeing to as it relates to where we want the education system to go. We cannot leave those persons out. So this is not just a single agreement that says, you did not get paid for 9 days, so we are giving you back. That's totally not what we are saying as a government. In the interest of the agreement, in the interest of the spirit of the agreement, we are saying that we are prepared to do this. Not in isolation. It has to be all of those conditions, which includes we must complete this code of ethics for teachers. We must work together to implement those code of ethics. And we recognize that during this period, we have made some significant progress in the education system. And in that light, we want to recognize all of our teachers.
Okay, can I ask a question now?
Anything about not docking pay if there is properly done according. If there's an instance where the teachers have the need to resort to that level of industrial action, is there anything in the agreement that speaks to that? Have they asked that government not dock their pay if they have to resort to that in industrial action?
Then I'll ask you to define what you interpret dock pay to mean.
What happened before? They stayed away for 10 days, and I know there are rules and so in terms of how long you can stay out and so on, finer aspects of the situation. But government is, I suppose, I don't know what it is, but
I realize you don't know what it is.
You've agreed to give them back the money based on conditions. You're asking them to toe some lines, and they're going to get what they're asking for. Basically, that's my understanding of it. I could be wrong, but and I'm still not understanding why you keep saying everyone is under the agreement, because while the rules that are being laid down, I understand why everyone must be included in it. What I'm trying to understand is the people who did not receive parts of their salary for that 10-day period. The agreement includes giving them back that money. But you keep talking about all the teachers, and this is what I'm trying to get at. Is it all the teachers are going to be getting some sort of financial incentive? Those who had their pay docked or those not? Are you saying that we did not understand and that all teachers in the country had their pay docked, which I did not pick up at all when they went on strike, because when they took rest and reflection, because this is not what I've been getting for all this almost a 2-year period. So is it that everybody had their monies taken away for those 10 days and that's why you're giving everybody back? Or am I missing something here and you're actually really just giving the people who lost their money? Or are you giving every teacher as part of this whole agreement that you're doing? And mind you, I quite understand that the agreement is going to include all of the
All
teaching
teachers.
population, and not just the ones who took the
Right.
action, because that would not make any sense, obviously. So that's what I'm
So
trying to
I
understand.
would one more attempt to clarify. No, and I think where you probably missed it is when you said you understand that some people may have done more days than they afforded. In other words, some people went off on some days and they have an entitlement to do so. And I think that's where we're getting it wrong. Now, those 9 days, all 9 days, all of it, there's no some days, all 9 days were not days that teachers were expected to be out of the classroom, because we were saying that it is a breach of protocol, an industrial mechanism to be out of duty without a legitimate reason. Now, the government took the decision, which is obligation, allows it to, that you did not work, so we are not going to pay for those days. So we've crossed that a long time. We've gone past that we understand, look, those days were a breach of Protocol 1, and they were also a breach of industrial mechanism. Now, what we're saying is let's sit down now and discuss, considering the entire education system. We cannot just have a discussion just about this, because we are speaking about precedents. And in so doing, when we have that general discussion, as you said, incentive, we are looking at 2 categories of people. We are looking at those persons who were not paid for the days they did not work, and we are also looking at the other persons in the system, and government took that decision, that those persons also form part of this agreement. But outside of this, we are prepared, we've taken a decision outside of this agreement that we will make that payment to these persons as well.
How does this payment going to appear in documentation? I mean, how is it going to make this payment?
Very simple. The government, and this would not be a first for the government has in the past made payments to categories of workers that falls under special payment, different ex gratia, different types of payment. So that's one of the
Can I ask a question?
Callistra, the minister is explaining the response to your question. Please avoid interjecting.
I think I did everything I could, Callistra, to explain this, that the government has taken an additional decision. So we've agreed with the union on these conditions that we would meet, and then government has agreed that this is what it's going to do as it relates to payment.
Callistra, such disrespectful behavior will not be tolerated at the post-cabinet press briefing. You're a journalist. Please act responsibly. Rena Pear, you had a question?
Minister, I had an interview previously with Mr. Andel, and he spoke of a document that was sent to them as it relates to agreement. They had an issue with one of the components, and you sent back the government sent back another one, stating, well, just for them to revise. Is there any indication that they would be meeting sometime soon? He did say within the 24-hour period, just like you did. So did you get a response from them as it relates to reviewing the agreement that you must have sent back to them due to you?
So as I said, it's been months we've been discussing. Several drafts have been going back and forth. We've been in several discussions. Where we are now, I think all that's left to be done is for the union to come back this one time for a final review of the document and for the signing. The signing could take place at that session, which is today, or it could take place at another session. But we are convinced that where we are now, it is just final review of that document and the signing to be determined whether it's at that session or another session.
So would you say hopefully by tomorrow we should hear something else?
The government has been prepared to sign more than a week now, so we anticipate that the union would say today when it is prepared to sign.
Thank you very much, Minister. Thank you, members of the media, for your patience for the extended post-cabinet press briefing this morning. I am Press Secretary Philomena Robertson. I look forward to seeing you again next time.
Stay up to date. The new National Party, NNP. Send us a message via text or WhatsApp on 405-8683 with your name, email, and constituency. Stay in the know with NNP. Get updated.
Hospital, and all the deaths have been amongst those people. This brand new coronavirus came from animals, and it's believed that the source was actually a seafood market in Wuhan, which also sells wild animals. So far as we know, all the cases have come out of Wuhan. So some of these people are in places like Thailand and Japan, but they haven't picked it up there. They actually got it in Wuhan and then they travelled. In China, where the most cases are, it's older people who are ending up in hospital with this. They're usually over 40, and the very youngest person diagnosed is about 13 or 14 years old. So it doesn't appear to be affecting small children, and those who've died tend actually to have underlying conditions, as they say. They're frail, they may have heart disease or cancer already, and so they're vulnerable. Basically, their immune systems are not very robust, and they're going to find it very hard to fight off a virus. We've only just discovered that the new coronavirus is actually transmitted from one person to another. It was hoped at first, actually, that it just came from animals, as all coronaviruses do, but now it looks as though it is actually passed from one human being to another. So we've got people-to-people transmission because the market's been closed for some time, and there are cases in people who've never been near it. So there actually isn't any treatment at the moment at all. Because this is a virus, antibiotics won't work. They only work against bacteria, not viruses. So really you want an antiviral treatment, but none of the flu drugs that we've got, we have got a couple of those, will work on this. A coronavirus is different from a flu virus. So there actually isn't any treatment at the moment at all. This one is scary because it is a brand new virus, so we don't know how it's going to behave. But I have to say, we perhaps ought to put it in the context of some of the other things. I went to Sierra Leone to cover the West Africa outbreak of Ebola, and that was killing more than half of all those people who were infected. SARS, which was a novel coronavirus, just like this one, back in 2002, did end up causing a global panic. And that was largely because nobody had ever seen it before, but also the death rate was at around 10%. Well, here, so far, we're talking about a death rate of 2%, which is a lot less. And it does look as if many of those people actually have had underlying health problems, which would make it more likely that they would die. They could equally have died of flu. So you have to put it into that context, I think.
patriotism. It's a paintorama. Once independence come, sadly the pains will wash away, some as quickly as the next day. But the things we do once.
Good morning, good morning, good morning, Grenada, Carriacou, and PT Martinique. You're listening to Hard Talk Grenada. A special good morning to those of you who are joining us on 89.5 CRFM, 92.9 Sister Isle Radio, broadcasting from Hillsborough, Carriacou, and of course 94.9 WE Noise Radio out there in Brooklyn, New York. A special good morning to those of you joining us on the live video, and of course to those of you who are on YouTube as well, joining us live. A special good morning to you. Now, we only have a couple minutes left, but of course, I'm here just to speak with you for a short while to reinforce, what was said on our post-cabinet briefing. I hope that the majority of you have had an opportunity to listen to our post-cabinet briefing. It was very informative. I'm sure that it would have quelled the majority of your concerns. At this point, I am of the firm belief that to those of you who still doubt, it's simply because you just don't want to believe, all right? And I mean, that is entirely up to you, but I am absolutely certain that we are ready as a country, as a state, as a nation to deal with a case of the coronavirus if that becomes an issue. And of course, we need to be ready now as a people, all right? Because it's one thing for the state to be ready to deal with a case, but it's another thing if the people are not ready. So we need to make ourselves ready, all right? And we all know what we need to do in order to get that done. Practice proper cough hygiene. Don't cough, don't sneeze into the atmosphere. Be mindful of the people in your surroundings. If you're sick, stay home now. We do have the influenza going around as well, which is just as bad, even if not worse than the coronavirus. And you have to take that into consideration as well. So a lot of us are out here talking about the coronavirus, but we also need to be mindful that there is influenza going around, and that can affect people with not so strong immune systems just as bad as the coronavirus can. So you want to keep that into consideration as well, and practice proper cough hygiene. Make sure that your hands are washed, sanitized. If you're not feeling too well, go to the doctor. If you think you can handle it at home, then self-isolation. Self-isolation is not just for when you have the coronavirus. I had the flu just a few weeks ago, and none of my children got it because I decided that it was important that I self-isolate, that I take the proper precautionary measures to ensure that my children are not affected by the cold. And it is the same thing that we have to do for the coronavirus as well. Ensure that our immune systems are up to par. Like Dr. Martin said, take your vitamins, take your minerals, eat your colored fruits, your yellows, your greens, your oranges, just to make sure that our bodies are able to handle any virus, any flu that may come our way. So you want to be mindful of that. They would have shared detailed information on how it is, how we are ready, how the Ministry of Health has gotten us ready to deal with an outbreak of the issue if the need arises. So we definitely want to be mindful of that. We want to take very, very, very cautious measures. We don't have an outbreak. We probably will never have an outbreak, but that does not prevent us from ensuring that we make the necessary arrangements to ensure that this happens. Well, I have a special visitor, but I thought this visitor was coming to talk. Nothing so but I'll do you that favor and make you that announcement. All right, so we want to be mindful of all of these things and take into consideration all of the people around us, take into consideration the children of our nation. Let's spend time educating them on what this virus is about and ways in which they can help to prevent the spread of the coronavirus or any virus that may hit off our shores or our borders. You know, education is always power, and some of us, we use education in the wrong ways, We use it in the wrong ways, but we want to definitely be mindful of that. I was having a very interesting conversation with a gentleman last night, and you know what I said? And of course, we agreed on that notion that as media personnel, we have a responsibility to the general public to educate them. Our responsibility is not to go and seek propaganda to make news. Our responsibility is to ensure that the public is educated. So if by some means or ways, right, you would have come upon a story, you know, and we find that happening a lot in Grenada. You come upon a story as a journalist or as a media personnel, and you publish that story, you post that story because it sounds good, well worded, you put it together and everything. And then for some reason or the other, you as the same media personnel come to the realization that this story is not factual, that this story is not true. What I don't find us doing as journalists and media personnel in Grenada is you do not go back and clarify your statements. Some of you just go ahead and pull it down, like we had recently over the weekend when one media journalist would have posted about 2 cases of the coronavirus within the St. George University, only to find out that that was untrue and it was propaganda. And for that said media journalist to now go back and fix the problem that she has created, all she did was pull the story down. There was no apology, you know, and we know who that journalist is. Over the weekend, she posted this story, this bogus story about 2 cases in the St. George University with no background, no facts. It was not true. There was no informed discussion to gain facts on the issue. But she posted the story, only to find out that there was no truth to that. But that journalist did not go back and pull down the story that she would have exposed to hundreds of thousands of people in Grenada and in the diaspora as well. What she did, she pulled it down. You know? So when we go on public fora and we speak about things as journalists, it is your responsibility to the people of Grenada to go back and clarify the information that you have misinformed the general public with. It is your responsibility to do that. You know, and we must be more responsible in journalism and in bringing information. You know, I'm not saying mistakes can be made. We're all human. Mistakes will be made. It is expected of us to make a mistake. No person, no individual is perfect. But what makes us come out on top, what makes us better, is when we can go back and acknowledge that mistake and correct it. And that is very important to note. So sometimes we choose to pull the negative out because it sounds better or it's more sensational. But we have to think, is that the most responsible thing that I can do, not only as a journalist, but as a Grenadian? You know, there are still people in Grenada who believe some of the stories that they would have heard. And you know, it's common knowledge when you tell a story to one person, by the time it reaches the 10th person, it's a whole different story, yeah? So you have to be responsible when you are put in a position where you are expected to provide the nation with information. Ensure that that information is factual. Do your fact checking. Information ain't hard to get in Grenada. It takes a phone call. But just make sure that the phone call you make is the right one, and that the information that you publish and the information that you share with the Grenadian public is a factual piece. You know, we just have to be more careful. We have to be more mindful. We have to be more cautious, and we have to care more. The Minister of Education would have given us some great news, good information, contrary to what I heard on the news and GBN last night, because I came to work with the firm belief that teachers were being reimbursed the money that was deducted from their salaries for days that they did not work. That was what I believed, because that is what the news carried, only to find out that that is not even the meat of the matter. You know, it's a collective decision between the Grenada Union of Teachers and the Ministry of Education to further improve the delivery of education in the education system in Grenada. It's something that we have been calling for and clamoring for. You know? We are now getting it. Let us look at the bright side. I know that some of the reporters, some of the people are eager and ready to get a story out first. But sometimes it's not about the quickness in the story, but it's about the fact, the effect that the story can have, and the changes that that story can make to one's point of view. So you have to keep that into consideration. I'm hoping that within the upcoming days, I can have the Minister of Education here to further elaborate and speak on what the Ministry of Education has been doing, because I know that they have carded this year as a year where they improve, work on the education system to make it better for our children. You know, I've been watching some videos, and I don't want to laugh. I mean, it's meant for entertainment, education through entertainment through education. That what you know show, entertainment show. And I've been watching some of the videos that have come out of that interview. Naz, I don't want to laugh, but we have a serious education problem in Grenada. You know, and it's not a matter of delivery by our teachers. I mean, some of the things that we should simply know, you find people that just don't know it. I mean, it's a little embarrassing when you come to think of it. But it just goes to show that every single person in Grenada need to be educated at some point in time. And I think we waste too much time focusing on the politics of things. We waste too much time focusing on the propaganda in issues, that we fail to realize that there are some people out there who are just searching for information, who are just eager to know, who don't care about the politics of the issue, who just care about Grenada. We just have to be mindful of these things. Let's do our due diligence as Grenadians, and let's ensure that our purpose always, whether it's in sharing information on the news, whether it's in a press briefing, whether it's on a program, whatever form that you choose to do it, ensure that the information that you provide is meant to educate, not to sensitize, not to create panic, not to mislead or misinform, but to educate the people of Grenada. You know, I sat and I listened to a program this morning on GBN, and I was very alarmed that the individual speaking on the program went there and made a pronouncement as it relates to the Flamboyant, where the Flamboyant Hotel used to be. That new development there, made a pronouncement about a track being removed, only to find out that the track has been relocated. You know, and then when asked about it, his answer is, well, if that is the case, I have not seen or I do not know. Then why would you go on a public forum and make this kind of pronouncement if you do not have the facts? And that is the biggest problem we have in Grenada, that the information that some people are willing to share is not in a means to educate the Grenadian public. It's not by any means to call on the government to do better, but simply as a means of propaganda, simply derived from hate. And that is a dangerous thing that we are doing as a people to our people. So we have to be very careful. And I'll say this every day until somebody stands up and says enough is enough. Let us stop these people from misleading us. Let us stop the propaganda. enough is enough. We have people on when are we going to, Naz, is there a law? We need to find out if there is a law or if there is some penalty for just purposefully misleading people. Because I believe that at some point this is becoming the order of the day in Grenada, where people feel it's okay to just go on public radio or to go on social media and just cook up a story and share it all over the place just in the event, just to make people feel a certain type of way about a political organization or about a person within a political organization. We need to stop this thing. It is going to damage us as a country. It will damage us as a people. We need to stop. All right? And that's all I have to say on that matter today. But I'm hoping that everyone has an opportunity to go back at 3 o'clock. We do a repeat of the program. And at 9 o'clock, again, we do another repeat. So you get an opportunity to view the post-cabinet briefing if you haven't had an opportunity to do so. Or you can go on our Facebook page once the program is over and the live video is down. You can go and take a look at it again. Just remain informed. Information is power, yes. But you have to be careful what information you allow yourself to be fed. All right? Now I got a special delivery of an announcement to make. Let me make that announcement quickly. The St. David's constituency wants to let the public know of their all-day independence cultural extravaganza. And that's happening tomorrow at the Latente Junction from 10 a.m. until, all right? There will be an exhibition, of course, of cultural items and so on. There will be food and, of course, a cultural show. So please make a special effort to attend and support. Guys, it's been a pleasure speaking with you. In whatever you say and whatever you do, be safe, be secure. We always want to be talking with you and never about you. Enjoy the remainder of your day.
Ministry of Health quarantines another Grenadian national. Details to this story and more in the national report. Welcome back. With the details to the news for Monday, February 3rd, 2020, I am Sherry-Ann Noel. The Ministry of Health on Monday, February the 3rd, 2020, quarantined the second Grenadian national who returned to the island from mainland China. The individual was met by health officials at the airport who conducted the mandatory interview before being placed into the isolation area in preparation for transfer to the quarantine facility in accordance with the ministry's response protocols. Health Minister, the Honorable Nicholas Steele, was again present at the airport to see firsthand the entire procedure. During the process, airport and health officials ensured that the first response team observed all the safety protocols to safeguard their personal well-being. The Ministry of Health reassures all concerned that there is absolutely no need for alarm. The decision to quarantine nationals with a recent travel to mainland China falls in line with the ministry's response protocol as it continues to take decisive action to prevent the global threat from reaching Grenada's borders. All travelers are urged to be guided by the ministry's protocol. The Grenada government is employing stringent measures to ensure citizens are protected from the coronavirus. It says any non-national with a travel history within the last 14 days from mainland China, whether in transit or originating, will not be allowed to enter any local port, whether in transit or originating. At the same time, any national returning to Grenada with similar travel history will be quarantined for 14 days. Government says while it recognizes and commends the tremendous efforts being made by the government of the People's Republic of China and the World Health Organization, it believes in light of the accelerated rate of confirmed cases, that decision must be taken to prevent the global threat from reaching Grenada borders. The travel ban on non-nationals with recent travel history to mainland China and the mandatory quarantine for Grenadians returning home after visiting or transiting through mainland China will remain in effect until further notice. In related news, the Ministry of Health has condemned as baseless rumors on social media which claims there is a presence of coronavirus at the St. George's University campus. On Sunday morning, Acting Chief Medical Officer Dr. Francis Martin and Senior Medical Officer Dr. Sean Charles, who heads the Ministry of Epidemiology and Surveillance Units, met with SGU's health officials to discuss the claims and concerns. It was then determined that no member of the university community has presented with symptoms that meet the diagnostic definition for coronavirus. 3 students with common upper respiratory complaints similar to a common cold were screened, deemed safe, and out of an abundance of caution were offered individual dorm rooms for self-isolation. The students have no travel history to mainland China and have not been in contact with individuals who have visited in China during the last 2 weeks. No students, employees, or visitors past the present are suspected of contracting the coronavirus. Moving along, the Ministry of Infrastructure Development, Public Utilities, Energy, Transport and Implementation has listed 33 major projects of focus for 2020 under the Infrastructure Development and Implementation. Some of these were outlined during the ministry's first meeting for the year, which was held at the National Stadium. The list includes 2 new projects that are under negotiation: the Caribbean Regional Air Transport Connectivity Project and the Caribbean Digital Transformation Program. The ministry also has a list of strategic priorities which Minister Honorable Gregory Bowen says must be achieved by working as a team.
Our strategic priorities for 2020: we want to ensure that you participate in the management of the ministry. So please review this document before you. I'm aware that the annual work plan has been finalized by the management team, and the pillars of our corporate plans will be succession planning. You note you have 3-4 workers. When they leave, you fall back into a hole. When that transfer is made of people to different ministries, we fall back into a hole. We cannot allow this to happen to us because we want to be operating at the pinnacle.
Focusing on the achievements and the shortfalls in his ministry for 2019 and the targets for 2020, Minister Bowen said performances, whether good or bad, reflects on the entire ministry.
The National Skills Development Program, Malmont and Riverside Center, UE Open Campus, the Cuthbert Peters Park. Cuthbert Peters Park, we have to refurbish. There's a complaint for the longest while that it was not completed and it is not functional. Maintenance of 12 schools during the holiday seasons. Technical team, when we say we're going to do some schools within the holiday seasons, we must do it because parents, teachers, and students are relying on us to get back into their school when the holiday is over. Construction of Simon Cultural and Sports Complex, special projects. But that's a big one, and you know that we handle it. Sometimes we handle over 150 projects in the year. They are small, but they require the same input from our engineers and road officers.
This is the National Report. More news after the break. Celebrations continue in observance of Grenada's 46th anniversary of independence under the theme, Preparing for the Future Through Empowerment, Growth and Long-Term Sustainable Development. Over the weekend, the National Celebrations Committee held its cultural extravaganza at the Grenville Bus Terminal. Honorable Kate Lewis said the theme is significant to Grenada's journey towards sustainability by 2035. She says the journey will present challenges, but the onus is on every Grenadian to ensure that it is completed successfully.
The government of Grenada has carefully selected the theme for this year's independence, preparing for the future through empowerment, growth, and long-term sustainable development. This coincides
with our plans for the new decade and a half, the 2035 plans that we hope to achieve, and we have started a consultation with all of our stakeholders, including you, the people of Grenada, Carriacou, and Petite Martinique.
The extravaganza highlighted local cultural performances and talent. The ecumenical service was held on Sunday at the St. Paul's Roman Catholic Church. Bishop Clive Harvey said 46 years will not have been possible without the many pioneers who have gone before. He encouraged renewed vision for the year ahead as Grenada moved towards stability, sustainability, and development.
Be of good courage. Hold fast to what is good. Render to no one evil for evil. Strengthen the faint-hearted, support the weak, help the afflicted, honor everyone, love one another, and serve the Lord, rejoicing in the power of the Holy Spirit and the blessing of God the Almighty, Father, Son, and Holy Spirit, be among us and remain with us now and always.
Governor General, Her Excellency Dame Cecilia Grenade, Prime Minister Dr. the Right Honorable Keith Mitchell, and other members of the upper and lower houses, the rank and file of the RGPF were all present at the ecumenical service on Sunday. The National Disaster Management Agency, NADMA, is working with the Royal Grenada Police Force to ensure the nation's children know how to protect themselves from fire. On Monday, the agency launched its fire prevention campaign at the St. George's Seventh-day Adventist School under the theme, Stay Safe from the Blaze. February is recognized as Fire Prevention and Awareness Month. Acting Disaster Coordinator Sylvan McIntyre says the intention is to ensure that the relevant information is disseminated not only at schools, but the entire country.
Stay safe from the blaze. In our analysis of preparedness across country, we recognize that fires have been happening more and more. Some have been intentionally set and others have been set because of negligence. And we believe that once information and people understand what they should do, that we believe that this activity would be minimized. We recognize that not only domestic and family homes have been destroyed, but we also understand that businesses are also affected. When families are destroyed, when businesses are affected, our economies, our livelihood would be set back. And so we would want to ensure that every sector, every woman, every man, every child understand what they should do in the event, not if, but when it does happen.
ASP Glenroy Corian, head of the fire department, says the students can also have a major impact in spreading tips about the necessary measures to employ.
We are advocating, definitely, we will want to see that come forward, be part of the school's curriculum in going forward. That will help. That will help. I'm re-emphasizing, we will love to see it embedded in the school's curriculum. Coming from that, what you will find happening, children will go home and talk to mom, dad, sister, brother, aunt, uncle, and they could formulate the plan of action for home also. That's what we're looking forward to see.
Roxy Hutchinson, Permanent Secretary, Ministry of Climate Resilience, encourages the students to further practice their tips.
We would have noticed that for the year we will already have several fires. And so we thought it's very useful for us to have this initiative as early as the month of February to ensure that we are all aware and we are reminded of the importance of staying safe from the blaze. Now, I'm not going to keep you very long because I know your attention span as children is not very long, but I want to congratulate you on your performance this morning. All of the reviews that I've heard has been positive with very little room for improvement. So I urge you to continue practicing your fire safety tips, continue to remind mommy and daddies of the need to have a family evacuation plan in the event of a hazard.
And with this, we come to the end of the National Report for Monday, February 3rd, 2020. On behalf of the entire news and production team, I am Sharian Noel, thanking you for viewing.